Hello, my name is Obiageli Chidi, student of Bradman University DMP program. This is my innovative video proposal project, Mobile Health Apps for Diabetes Self-Management. My pickup question goes as follows. Among diabetic Hispanic male ages 21 to 65 in primary care setting, does utilization of diet and exercise educational program compared to those who don't utilize diet and exercise educational program improve A1C level over a 3-month period? The problem innovative project will solve. First of all, we need to know what is the problem. Poor diabetic self-management evidenced by increased A1C and diabetes complications. Where is the problem? Amongst diabetic patients all over the world with poor self-management abilities. Who is affected by the problem? Diabetes patients, their family members, and taxpayers too. What will be different if the problem was solved? Improved diabetic control, decreased hospitalization from diabetes complications, and of course saved cost of hospitalization, healthier individuals, and taxpayer dollars channeled to other areas of need. Let's talk about the facts about diabetes. Diabetes has been on the rise among Americans, affecting as many as 30 million people as of 2015, according to the American Diabetic Association, ADA. Diabetes and its complications have been shown to be the cause of death in about 80,000 deaths per year. Statistically, it has been shown that the United States, Hispanics are more likely to be diagnosed with type 2 diabetes than several other racial demographics. Amongst the Hispanic population, the prevalence of type 2 diabetes is 12.1%, compared to 7.4% in non-Hispanic white population. The lack of comprehensive diabetes education on diet, exercise, food care, regular eye exam, lifestyle modification contributes immensely to the problem of poor management of diabetes and uncontrolled blood sugar levels. From a lack of knowledge on what foods to avoid to not knowing how to monitor blood sugar levels at home, it is apparent that the lack of information is a major obstacle to obtaining successful self-care regimens amongst diabetic patients. Thousands of dollars are spent yearly on diabetes-related complications and hospitalizations. Diabetes education clinics have been used in the past and are still being used to provide diabetes education. But a lot of times, patients don't show up, or they easily forget what they are taught. Collaborators used include family nurse practitioner colleague, who is a clinical leader, the head of IT, who is also a medical doctor with IT expertise, and the medical director, who is the administrator. Why were these collaborators chosen? They all have in-depth clinical knowledge. They are all computer savvy with expertise in navigating the EMR and computer applications. The administrator has the power to advocate for the implementation of a new software for use in the clinic. They also can influence the widespread adoption of mobile information technology. The IT technician has great technical knowledge on how the mobile information technology could be implemented and possible challenges with the implementation. So the contributions made by these collaborators: the clinical leader was optimistic about the use of this mHealth mobile technology. She believes it will improve patient medication compliance and diabetes self-management. The IT technician finds the application user-friendly and easy to navigate which will encourage patient compliance. The administrator believes the application will be a valuable tool to implement in the primary care setting. It will also lead to improved healthcare outcomes amongst patients, which will translate to higher outcome scores and higher reimbursement to the facility. The mobile app proposed is an mHealth application called the FuTouch application, FTA. This application, FTA, is an example of a tool designed to support the self-management of diabetes. The FTA consists of mobile phone-based diabetes diary, where blood glucose can be transferred automatically or manually. This application has a simple data display and decision support prompts and alerts that integrate into daily workflow of blood glucose testing. The mHealth app can be used on any smart device like the iPhone, Android, iPad, iPod. It is used with a live scan glucometer and a Bluetooth adapter for automated transfers to the app. This design was equipped to hold 10 different applications and functions on how patients with diabetes can maintain control, educate, provide food log, and communicate with their healthcare provider on self-management of the condition. How does this app address the problem? It will help patients with diabetes to take on more analysis and decision-making tasks in a timely manner, leading to more proactive self-management. Reasons the proposed solution is innovative. Self-management is critical to achieving diabetes treatment goals. Mobile phones and Bluetooth can support self-management and lifestyle changes for chronic diseases such as diabetes. I've chosen a mobile application mHealth app, which I hope will be able to improve the self-management of patients with diabetes. Mobile health applications delivered through smartphones or tablets have the potential to help patients manage their diabetes. Research indicates that using a diabetes app through a smartphone to track blood glucose and diet can increase adherence to diabetes management and self-monitoring. What are the possible concerns? Lack of computer literacy could be a deterrent to the use of the mobile app. Fear of personal data being hacked. Studies demonstrated that mHealth acceptance is high, but current engagement is low. The functionality of existing apps did not currently meet the preferences of their potential user group. Functionality and user engagement could be improved by including relevant stakeholders in future app development, which should be driven by clinical and user need as opposed to what is easiest to develop. In conclusion, the use of mobile health app has the potential to improve health outcomes amongst those living with the chronic diseases through enhanced symptom control. This is relevant to my project on improving diabetes management. Functions in mobile app include interaction functions such as messages and chatting with healthcare personnel, health monitoring functions such as tracking blood glucose, weight, blood pressure, medication, lifestyle monitoring functions such as physical activity and dietary habits, and educational functions which provides information to patients on diabetes. Mobile apps will be a part of the healthcare system in the future. Therefore, we require robust research in this area to assist in developing apps with all the functions needed to improve diabetes self-management. Further innovation, optimization, and rigorous research around the potential of apps in mHealth technology will move the field towards the reality of improved healthcare delivery and outcomes. These are my references. This is the first slide with my references here. And this is the second slide with my references. Thank you for viewing my innovation video proposal.